Hi, good evening, everybody. I'm Dr. Betty Tay. I'm a consultant cardiologist, and welcome to our episode of Borak Borak Medica. Today, we are interviewing Dr. Lai. Dr. Lai Fong Tua, actually a consultant psychiatrist, child psychiatrist, and adolescent psychiatrist. He has been awarded, actually, many awards in Penang. Welcome, Dr. Lai. Maybe we can actually ask you a few things about autism because you have worked with autism through NGO, if I'm not mistaken. Or do you handle autistic kids in your practice?
Yes, I do.
So you do handle autistic kids in your practice too?
First in general hospital and now in a private hospital.
In private hospital. Which private hospital are you practicing?
I do sessional in Island Hospital as well as Pantai.
And then you do you are quite heavily involved in the NGOs with your wife.
Yeah, yes.
Can you please actually define what is meaning of autism? The rest of us we don't know many things about
autism. The more common, not more popular term nowadays is autism spectrum disorder. So
okay.
it's actually a spectrum. It includes actually a few diagnoses. Autism spectrum disorder is a term used in DSM-5. So it includes the more severe autistic disorders, and then the high functioning Asperger's disorders, and then there is this PDD-NOS, pervasive developmental disorder, not otherwise specified, which is children who have symptoms of autism but doesn't fulfill the criteria for the first two diagnoses, then they put it under PDD-NOS. So,
what is the prevalence of autism in the general population of children that are born?
It depends on which one you look at now.
Okay.
Years ago, when I think we were in medical school, when we talk about autism, people actually only mean autistic disorder, which is actually the severe form of autism or infantile autism. So in the severe form, it is actually very low. The prevalence is very low. But now with this new criteria, autism spectrum disorder, the prevalence actually has come up to nearly 1%. That means out of every 100 children, one child can have autism spectrum disorder.
Correct me if I'm wrong. Is it more common in boys than girls?
Yeah, supposed to be. Yeah, much more common in boys than girls. So, there were specialist scientists in this area who said that autism is actually a male problem. that's what people used to say. Yeah.
Is it genetically linked to the chromosome of the male?
No, not
Y
really.
chromosome, not at all.
No.
Okay, so genetically, is there do we know the genetic mapping or the mutation?
I think a lot of studies has been done in this lah, but it's quite complicated. It's not a single
black and white thing.
Kind of thing lah. Yeah. Okay. It's a multiple kind of.
Another thing that I'm very curious about is this autism. Is it something that is new? I don't believe I can remember studying about it in medical school, and I don't remember it being so common when I was a child or seeing children of that, that behavioral differences that we see in autistic kids.
Okay. Maybe before we talk about the prevalence, I just share with you the core symptoms of autism spectrum disorder. There are actually three main core symptoms, right? Core features lah. One is the language impairment. So a child with autism usually have developmental delay or deviant kind of development in the area of language development. So either the child has delayed speech development, they can't speak even at 3 or 4 years old, or when they do speak, the language is not normal, okay? That is the language part. Then there is this social part, social development, which is impaired. So usually we will see things like poor eye contact, the child doesn't look at people, the interaction is different from other children. They have difficulty making friends, they have difficulty understanding social cues, understanding social norms, and they usually get into trouble socially with their peers. Okay.
When you say, sorry, Cam, when you say they get trouble socially, it is not something like a psychopathic kind of social.
No.
It's just not fitting in.
Not fitting in, correct. And then the third core symptom is actually this rigid, repetitive, stereotype kind of behavior. They have this special interest in some very different things. Usually children are not interested in those things, but children with autism spectrum disorder, they are interested in them. So example, like some children with autism spectrum, they like number plates. So they will just look around for car number plates and they will read it aloud. You know, that's all they do. You give them a toy. Sorry?
I used to do that as a child.
Okay.
Yes, true. Because I used to travel from KL to Alasta. I mean, it's a long way, and that was how I kept myself occupied. But yes, go on. Sorry.
So I think that the features, many of us actually have some features of autism spectrum disorder, but is when these features come together, when people have all three, or the increased intensity of them, then it interferes with normal development, interferes with learning, interferes with going to school. That's when the problem starts.
And of all the autistic kids, I mean, most times can they come out of it and lead a normal life eventually?
There is actually a continuum from mild to severe.
Okay.
So the severe form of autistic disorder, usually they need a lot of help. They need a lot of early intervention, a lot of like speech therapy, social skill training, and so on. The milder forms, especially if they have normal or above normal IQ, they can as they grow older, they sort of learn techniques to help themselves. But most of them actually would need some form of assistance.
So how early do you start this assessment? How do we, as parents, in the early stage of the child, look out for signs and of autism so that we can intervene earlier?
It's actually better to pick them up as early as possible.
Yes. So how do we, as parents, try to pick up signs to say that, oh, this could be possibly autism?
Yeah. Parents, like mothers who have a number of children, usually are very good at picking them up. That means, especially
if comparison, yes.
So you compare your child with the other children. So mothers would tell me that, this baby of mine doesn't look at me when I smile at her and things like that. So in comparing your child with another child the same age, that helps. Delayed speech development, usually by 1 to 2 years old, we would expect some form of speech, two-word speech and so on. If by 3 years old the child still doesn't speak, then there is a red flag. In clinic kesihatan nowadays, there is this MCHAT screening. babies at 18 months old, the nurses actually knows how to screen them.
Oh, that's great.
Huh? That's great.
Oh, you mean the nurses are trained to screen? That's great. Okay, go on.
Yeah. So they screen, and if there are significant signs that the child may be autistic spectrum, they will refer the child on to specialists for further assessment.
Okay, and then what kind of intervention can you do, and what is available in our country at this present moment for parents with autistic kids?
Many parents do not want to, find it difficult to accept the label of autism lah. So my advice to parents is actually don't worry about the label. You know, a lot of parents will bring the child and say, is my child autistic? The psychologist say it's not, but the teachers say it is. You know, who is right? So I tell the parents, don't worry about who is right. The important thing for you to do is to get your child some early intervention. You know, if he's slow in learning to talk, get him to see a speech therapist to assess and do some speech therapy. If he doesn't socialize, you know, bring him to a play school, play group where he can interact with children, encourage them to play. So don't worry about the label. A lot of children, once you start early intervention, a lot of them by age 6, the symptoms actually goes, you can hardly find symptoms that will fulfill the criteria.
I see. So actually, if you intervene early and you encourage and nurture the child early,
yeah,
they can actually fit in, and so that period of time from 4 to 6, 4 to 7, where you may think your child is autistic, but actually eventually child can actually fit in normally and become okay. Are you trying to? Yeah.
They won't be totally normal, but they can sort of be registered in normal schools. You know, go to normal classrooms, interact with normal friends,
and even excel in the studies eventually.
Oh, study is a different. There's no problem with studies.
Oh, no problem with studies.
Autism spectrum disorder, IQ usually are not affected.
Okay. So only a small percentage of autistic children, the severe kind, is difficult to assimilate them into the normal schools.
But with early intervention, that is a possibility.
Oh, I see.
So the earlier you intervene, the earlier you give the child some help, then it helps.
And in our society in Malaysia, acceptance, of course, of parents that their child is autistic is quite difficult. I can understand, because labeling anyone.
Surprisingly, nowadays, quite a lot of parents are quite aware of that.
I see. No, not so much a stigma anymore.
Not really.
Okay. Then what kind of support do we have? Okay, private or public kind of centers that can actually help out children? Because you say that speech therapy can be very costly if it's not with the government sector.
Actually, the government service, the Ministry of Health actually has done quite a lot. Like I told you, the MCHAT, the modified the screening ASD is actually started in the whole country in all the clinic kesihatan, you know, to pick up children with autism spectrum disorder. And then, now there are quite a number of pediatricians who specialize in developmental pediatrics. So they are actually the best people to see for young children with autism, with developmental disorders. The other group are child psychiatrists, which are actually also a growing number in public hospital as well as private. And then speech therapists are actually increasing in number as well. We have local training faculties in our local universities that train speech therapists. Now every state, I think major hospitals in a public hospital in the country has at least one speech therapist. Most of them are based in ENT department, surprisingly.
Oh.
So if you want to find a speech therapist, they are in ENT department.
And how do they work with these children? What do they actually do?
They actually assess them first to see whether there are other limitations, like hearing problem and things like that. If not, then they will work on their communication. Actually, language development includes communication, interaction, and then teaching them how to pronounce words, phonological awareness, and so on.
And this obviously will involve the parents' participation.
Yes, we actually encourage parents to learn, because unlike overseas, our trained personnel is actually quite limited. So like Penang GH, a child going for speech therapy, on the average, only gets to see a speech therapist once a month, which is a bit too far apart. But because of the workload, and we don't have enough speech therapists to cover, that is the best. Yeah. So the next best thing to do is to teach parents how to work with their children at home. So it's good for parents to learn it up when their child is having a session with the speech therapist, then go home and do the same thing with them.
How about the very severe ones? It's almost impossible to them special schools, and what kind of options do parents have for this, children?
Okay. Autism spectrum disorder, if they are mild or moderate but with high functioning, that means their IQs are quite all right. We will actually recommend that they go to normal classrooms.
You will recommend they go to normal classroom? Okay.
Probably a smaller school, not the premier school, A class maybe with smaller number of children. Nowadays, there are many schools called SKM, Sekolah Kurang Murid. So those
I see. I never knew that.
Yeah, those are good schools to go to, because the teacher would have more time to spend with the child. Okay, so go to a normal class. Only when they can't cope with the normal classroom, which is called they call it the integrative kind of system. Then they come out to the specialized class, class integrasi, where there is one teacher to 8 students. So in our Ministry of Education, we already have this setup. Okay, although the teachers would do much better with more training in this specialized area.
And how do you then treat autism in adults? Okay, some may have been missed cases, some have maybe have been neglected, and they are now older kids or near adulthood. What do we do with this stick?
Again, it depends on the continuum where they are. I've come across a lot of young adults who actually managed to go to school, managed to get their SPM cert, or even go to college, but they are faced with problems of having no friends, problems of can't keep a job for too long, because many of them, their social skill is no good.
Yes.
So like if they work in an office, their friends want to go out for lunch, they don't want to go with them. Then they others will feel that they are weird. They don't want to do things. So after a while, he feels that he doesn't belong, and he'll resign and stay at home and play computer games.
Also, a lot of them end up like that.
Yeah.
So how do we support this kind of people? That
Malaysia is quite fortunate. I think it's a work of Dr. Amar Singh, as you mentioned just now. Together with, I think, Yami Ang, they started this AIM, Autism Initiative Malaysia, to help young people with autism spectrum disorder, mainly high functioning. So they actually work with corporate companies like Muda to set up classes to train them, how to socialize, how to work with people in offices and workplace. So it's quite.
So these are all NGOs now.
This one is an NGO.
Oh, okay. So they train this adult or adult with autism how to fit into working culture.
Correct. And then the other thing you may be interested to know is internationally there's this company called Auticom.
Oh, I see.
AUTICOM, I think. Is actually short form for Autism Company. Started by, I think, parents who have children who are growing up who has this autism spectrum disorder and couldn't fit in other people, factories and offices. So some of these parents, they have the ability, they set up their own company and they employed people who has autism spectrum disorder. And so they have very interesting rules in their company.
Okay, tell me.
Rules like you do not have to go for lunch with your colleagues if you do not want
to. Okay, sounds like me.
If you want to sit in a dark corner to work, that is okay, very strange rules, but rules that make the environment friendly to people who have this autism spectrum disorder.
But what business do they do?
A lot of them do
IT, a lot of IT companies. They set up some IT companies.
And this is not in Malaysia, lah. Is there one in Malaysia?
Started with US. I think Europe started. AIM actually was planning to invite some of the entrepreneurs to come over for a conference to tell us how they do it. And then the COVID started. Couldn't have
okay. Yes. Maybe after the COVID, we can invite them. Yeah. And then the other thing is, I want to ask you, is that let's say you have autistic kid, is it more likely that you will get autistic kids after that? I mean, does it run in families?
Yeah. There's an increased risk genetically. Even our children with autism, if we ask them, do you have a cousin or an uncle who have similar features, they will tell me yes. They can find someone in the family, extended family who has some symptoms.
Oh, so it's quite strong genetically linked.
Yeah.
And the other question I'll ask you is, I think I've asked you earlier, is it a new disease? Is it a disease at all?
Yeah, it seems to, the number seems to have gone up very fast the past few decades.
I've never, like I said, I've never noticed
it
or heard of it before. When I was a kid or when I was even practicing my early years.
Here and there, we would have like uncles or grand uncles who are very quiet, doesn't have friends. They may have ASD, but we don't see so many of them last time. But nowadays, they seem to have more.
Are we, was it that we underdiagnosed previously or we overdiagnosed currently? People who are...
Partly could be due to the diagnosis. I mean, we are diagnosing more now, but that alone, I think, cannot explain the number we
increase.
are seeing.
Yeah, because I mean, socially we are different. Okay, I mean, our social norms and our parents' social norms are different. Interaction seems to be normal thing last time, but now with all our gadgets and us being very solitary, I can't imagine me being diagnosed autistic. But now that you mention all these symptoms and signs, it sounds like I fit in. You know, liking to sit by myself, liking to doing
You're doing very well.
But I'm a woman.
There is actually a famous professor. Yeah, there's a famous professor. Her name is Temple Grandin. I think in her 60s now in America. Lady. Okay. Professor Temple Grandin. She has autism when she was young.
Oh,
she gives a lot of talk. She gives a lot of talk. You can get her on YouTube. She talks about autism to parents. She has very interesting interests. She likes this animals, animal husbandry. She designs slaughterhouses for, I think, for McDonald's and
oh, that's gross. Okay, another thing I'd like to know is autism associated with an increased risk of mental health problems like depression and anxiety?
People with autism, especially those who have normal or high IQ, they actually know that they are different from others. So, okay, people with ASD, with high functioning, the other term is Asperger's. They actually know that they are different from other people. So the stress is a bit higher than normal, than their peers.
Okay, so they do feel more stressed out.
I just...
Sorry, you're a bit laggy.
You know the story of, I think you would have known the story of the story of Ugly Duckling.
Okay, of course I know the story of Ugly Duckling.
Yeah. Okay. The author of this story, Hans Christian Andersen, he has Asperger's. He has high functioning autism. So Ugly Duckling probably was his own experience when he was growing up. He felt that he has no friend. He was different from other people. He was bullied. He was ostracized.
It sounds more and more like I am.
But the good thing is, in the end, it turns into a beautiful swan.
Okay, but no, this Hans Christensen, he was born ages ago.
Yeah. So it does exist in the past, lah.
Okay, but now we see a lot of severe cases. Do we not see more severe cases these days? I have come across so many people that is either patients or friends who have somewhat have autistic kids. It is so common that every other person I speak to has somebody a child that is labeled autistic.
It's partly because of the criteria has been broadened, has been widened. Yeah.
And now it is, of course, not just difficult to be autistic and dealing with it. It must be very difficult for parents to have an autistic kid, right?
Yeah.
How do we support these parents?
Yes. The AIM actually was set up partly for that, to support parents. Earlier, there was this NECIC, National Early Childhood something conference. which was also set up by Dr. Amal Singh and I think Yami. So they were set up to help parents with children with autism. In KL, I think that there are quite a number of NGOs, Penang as well. Other places, I think that there are others that I do not know. But usually such NGOs are set up by parents to help parents. So I think it's a good thing that parents are coming up to support one another and help one another. There is a BM website called Autisma Malaysia, AUTISME Malaysia. Most of them are, I think, Malay parents. So the website is in BM, and a lot of my Malay patient parents also goes there to find support.
That is very good. I want to tell the audience that Dr. Lai is actually blind. He has retinitis pigmentosa, and despite all that, he's still very active. Can you tell us about how you were diagnosed with retinitis pigmentosa?
I think when I was in teenage, I started feeling afraid to go out at night. Not sure why.
I see, so young.
Teenager during teenage time. Then when I was in Form 6, one of my friends, classmate commented, Lai likes to kick tables and chairs. You know, I don't see them on the side.
Okay. That's how my cousin, we found out about it also. Okay, go on.
Yeah, so I will accidentally knock chairs and tables. So this classmate of mine said, "Hey, Lai, why you like to kick chairs and tables?" Then also I didn't know what was the cause. So until I was in third year medical school, so we were doing ophthalmology. So I went and saw this Professor Chandra. Nice professor. First time I went in to see him, he was so busy. I said, I can't see so well. So he immediately sent me to go and make glasses. And that was it. Then the second time I came again, but this time I smarter. Instead of saying I don't see well, I said I have night blindness and I have tunnel vision.
Okay.
So those two words put together to a ophthalmologist strikes a bell, you see. So he started to check me properly, and then he told me, "I'm so sorry, you have retinitis pigmentosa. There's nothing you can do." And then he said, "I advise you, you graduate, you go and be a GP, earn as much money as you can." Retire. That was his advice to me.
What the? Okay, and you were only a third year medical student, and your visual problem started even before you went into medical school.
The fortunate part of it is my visual problem deteriorates from periphery inwards.
Yes.
So I still have my central vision quite intact. So reading, I should still do, like looking at X-rays, all can be done. So that was fortunate in my part.
Okay, can you just tell the audience what is retinitis pigmentosa? Because I can't, I know
it's
much
a
about
degenerative disorder of the retina, where the retina has these light sensitive cells, the rod and the cones. So the cones and the rod starts dying off. It starts to degenerate. So it dies off and slowly dies off. So mine disappears from the periphery. So you can see the vision, my vision going narrower and narrower and narrower.
So we call it tunnel vision. So basically you can only see what's right in front of you and not at the side. That's why he kicks the chairs.
Yeah, and because the rods are also affected, so at night I can't see so well. So there's night blindness as well.
And it's something genetic, right?
Yeah.
And but you are the only one in your family who has it.
Yes.
So it's
yes.
mutation.
Don't know what.
Okay, or bad luck.
Don't know.
And none of your children, all your kids have been screened. You have 3 sons.
Yeah. They don't
And
have
none of them have any problems.
Yeah. Not
Okay.
RP lah. Not retinitis pigmentosa.
Okay. From the time that you were diagnosed, okay, and how long did it take you? How many years or decades before you became completely almost blind? Now, what's your vision like? How many percent?
Less than 2%. I think less than 1%.
Less than 1%.
Centrally is also quite blurred. So I'm legally blind. I can see shades. I can see light and dark. I can see contrast. That's a bit odd. Letters that are very huge fonts, I can see.
Okay. And obviously you can't drive now.
Yeah.
How long have you not been driving?
I got my license. Then only I diagnosed with this RP. And looking back, actually, when I was taking my license, my instructor actually took me out to teach me driving at night.
Oh my God.
I remember there was one moment I nearly banged into a pillar. The instructor had to turn my wheel and say, "Hey, can't you see?"
And you still got your license?
Because daytime, that one.
Okay, daytime not a problem now.
Yeah, but I never used my license lah. After that, I got diagnosed there, so I stopped. I didn't.
Oh, you mean you never drove after 23 years old?
Yeah, no.
You never drove?
I drove, but never really. By the time I have money to earn a car, then I didn't drive.
Oh, okay.
Don't have money to buy a car.
I see. Okay. So when did, okay, for example, you did you finished your medical school, obviously, and you were already losing sight. When you did your psychiatry, how many percent of sight do you have?
At times still, I think about 30%.
And then you went on to do training in Oxford for 2 years, if I'm not mistaken.
Psychiatry,
that's right.
General psychiatry, then JPA scholarship gave a scholarship to do a 1-year attachment in
a child psychiatry, right?
Yeah.
And that time, were you
still can get around?
Still can get around. So
but
how dependent are you on your wife?
When it's dark, daytime I can still be okay.
Now, how about now?
Now cannot. Now I have to go around with a friend or my son or my wife.
And how do you see this blindness? I mean, how do you accept it and how do you deal with it?
I think a lot has to. I don't know. I attribute a lot to my faith lah. I became a Christian when I was in teenage school. So belief in God helped me a lot lah. So trusting in God to help me sort of pull me through a lot of difficult times. There were times when I was really depressed and no hope kind of thing,
I see. Is it and this depression and no hope, was it because of your blindness or because of other issues?
Yeah, because of the gradual losing of sight. It's a bit difficult to accept. Every day you see your sight going off a little bit more.
Yes. Okay, so you did go through all the emotional turmoil that was related to losing your sight, but you overcome it, and you think that you overcome it by having a faith.
Yeah. That is one strong factor lah. The others is family support, and then my wife came along, so she supported me.
Oh, okay. You met your wife in UK, is it?
No. In church.
You met your wife in church. So God did give you many things lah, even though you lost your sight.
Yep. Yeah.
I went to UK.
And
my wife went to UK with me
yes,
to
I
support.
heard. I spoke to your wife briefly, and then she told me about your love story also. And did you learn how to use the Braille?
I was asked to learn that, but I didn't really use it.
So how can you text and everything?
Nowadays with IT is actually, I'm very fortunate to be living in this era, you know. A lot of text to speech, speech to text kind of.
Oh, I see. So you speak to it like Siri.
I learned touch typing, so I can type letters.
How is this touch typing like?
You know, the normal typing.
Uh-huh.
When you are very used to typing already, you don't have to remember which.
Okay. Just like the secretary last time.
Correct.
Okay, but how about the handphone and all?
Handphone, it reads like iPhone. There is an app called Voice Over. It reads everything for me.
Okay, and then when you see a patient and you need to record it on the notes, what happens?
That time I can still write. That
like
time,
now you're still seeing patients, right?
Now I have an assistant to assist me.
Oh, I see. And then you teach, you are a part-time professor also in Penang Medical College.
Yeah, they changed the name to RUMC, Royal College of Ireland and UCD. Yeah.
Okay, and preparing slides and everything?
Okay, do myself.
Preparing slides I can still do. Putting pictures, sometimes I ask my wife to help me put pictures.
Okay. So and then now you have overcome your emotional, you have accepted your blindness completely?
Yeah.
And and when did you come to accept this completely?
Can't really put a date lah.
About how old were you then?
I think a few years. I think by the time I start working, it was almost okay already. I think when I joined my master's in psychological medicine, when I know where I'm going, then.
So when you saw there was a future despite your blindness, you were fine.
Correct.
Okay, good. So I have some questions. Some people have asked some questions. Nicholas, you asked, what pharmaceutical options are there to treat autism? Are they effective? He said he once read autistic patients have some sort of inflammation of glial cells in the brain. Is that true?
Those are still under research. The mainline treatment for autism is actually educational, behavioral and educational. So you need to do early intervention for the child. A lot of they call it ABA, applied behavioral analysis, where the therapists do one-to-one kind of session with the child. They use a lot of educational behavioral intervention. So medication actually is more second line. Second line means if the child has behavioral problem, like he starts biting herself or banging his own head, then we give medication to stop that. But other than that, the mainline treatment is still risperidone drops, risperidone solution has been found to be quite effective. Risperidone drops in the area of 0.1 to 0.2 mg at night.
Drop into the mouth? Just
one drop. Drop into the milk, drop into the Milo.
Oh, I see. For them to drink.
Yeah.
So these kids can be harmful to themselves?
Some of them, not all. Some of them can be self-injurious. They hit themselves, they bite themselves.
Jack Tan asked, how do adults who is undiagnosed with autism get diagnosed?
Bring them to see a psychiatrist who has worked with psychiatrists or clinical psychologists who have experience working with children, teenagers with autism. Yeah.
And then is there a set of criteria that you can tick and say, okay, this woman, Betty Tay, has autism?
Usually we still go for the three areas, the language.
But as an adult?
Adult is more the social part, social difficulties, but we will take a history and see when, as a child in their development, whether there are any indications of autism spectrum disorder.
So maybe we underdiagnosed when we previously because we're not aware of this condition, right?
Possible, yeah.
Possible.
One big name in this area is Tony Atwood. I mean, those who are interested in this area. Tony Atwood is a clinical psychologist in Australia, Brisbane, who has done a lot of work in this area of autism spectrum disorder, high functioning. So you can Google him. You can.
And when you say high functioning autism, right? Are these really specially smart or talented or gifted?
Not more like normal IQ, normal or above normal IQ.
And
I have one case just to illustrate This boy actually is in college already. So one day the lecturer was teaching outside, and from the back he saw one female classmate that he has an interest in. So while the lecturer was teaching, he walked to the girl and said, "Can I have your handphone number?" With the lecturer teaching in front, So everybody stared at him and said, "What are you doing, I'm asking her for her handphone number." So he got scolded. Then he was still.
That's not autism, that is love.
No, he said, "Why can't I ask her for the number when you're teaching?"
Exactly.
Everybody knows cannot, but he doesn't know. So socially, he has that impairment. So many children with young people with autism spectrum, high functioning, they can do a lot of things, but sometimes socially they become awkward a bit. They do things that shouldn't be done, and everybody else know that it shouldn't be done, but they don't know. They just do it.
Well, sometimes it's called love and courage, Yes.
Not with the lecturer teaching in front.
Anyway, we have spoken for almost 50 minutes, and I think we will stop here.
All right.
I'd like to thank you very much, and Indrani, your lovely wife, for this opportunity for us to know more about autism in Malaysia, especially the support that the child can have, and then parents will now know better what to do, and the schools that they are able to go to. And also, thanks for telling us so frankly and about your how you handled blindness. I find this very amazing and inspiring. Yes, it is. I can understand the emotional burden that you had to go through. I'm sorry, but then I'm so glad you overcome everything and then contributed so much to society. The fact that you never left public service, serve public all through your career until you retired. So I think it's really, really something that we all admire a lot. And I'm glad you didn't become a GP to make money, like Professor Chandra said.
Okay.
So I think you You made him proud, I'm sure. And you make a lot of us proud because you achieve more than a lot of us could have with normal vision. So with that, thank you guys. Thank you for watching Borak Medical. And then we'll see you again. Bye. Next week there will be no session because I'm giving a webinar to doctors. Bye guys. See you. Thanks.
Okay.